Your teeth face a silent attack every single day. Bacteria multiply in your mouth within minutes after eating, releasing acids that eat away at your enamel while you sleep and go about your day. Most people only realize the damage when pain strikes. But there's something most people don't know. Your teeth have a natural defense system. When working properly, this system can stop early decay in its tracks. The problem? Most of us unknowingly shut down this defense mechanism. Barbara O'Neill, drawing from the book Holistic Dental Care, The Complete Guide to Healthy Teeth and Gums by Nadine Artemis, shares a traditional practice that's been around for thousands of years. Recent scientific studies finally tested it. You probably already have everything you need in your kitchen. Every time you eat, bacteria feast on food particles. As they break down these particles, they produce acid as waste. This acid damages your teeth. Research confirms that teeth undergo constant battle between demineralization and remineralization. Demineralization happens when acid dissolves minerals from tooth enamel. But here's what's fascinating. Your saliva contains calcium, phosphate, and fluoride ions. Under right conditions, these minerals rebuild your enamel. This process is called remineralization. Scientists discovered that early-stage cavities appearing as white spots can reverse through proper remineralization. The key word is early stage. Once a cavity becomes fully formed with an actual hole, it cannot heal, but white spot lesions respond well to remineralization. Your saliva plays a critical role. It neutralizes acids, washes away food particles, and delivers minerals that strengthen enamel. When you're dehydrated or stressed, saliva production drops. Barbara O'Neill, referencing Nadine Artemis's work, calls these your two superfluids: the internal fluid, blood and lymph, that nourishes teeth from within, and the external fluid, saliva, that bathes them from outside. Both need to be healthy for teeth to heal. Before we continue, subscribe for more natural health wisdom backed by science. Drop a comment telling us where you're watching from. Barbara O'Neill recommends oil pulling, an Ayurvedic practice used for thousands of years. The method? Swish oil in your mouth for 10 to 20 minutes, then spit it out. Recently, researchers tested whether this works. A systematic review examined clinical trials on coconut oil pulling. Researchers analyzed 4 randomized controlled trials involving 182 participants. These were rigorous scientific experiments. The findings were interesting. One study found that coconut oil pulling reduced harmful bacteria. Another showed it worked as well as chlorhexidine mouthwash, a prescription-strength antibacterial rinse in reducing plaque. A 2025 study examined virgin coconut oil pulling in patients with chronic periodontitis. Results showed significant reduction in both microbial load and inflammatory markers, comparable to chlorhexidine, but without side effects like tooth staining. Here's why coconut oil specifically works. It contains lauric acid with natural antibacterial properties. Research shows it breaks down cell walls of harmful bacteria without killing beneficial bacteria. This selectivity is important. However, the evidence has limitations. A review noted that while oil pulling shows promise, scientific evidence is still limited. The American Dental Association states there's insufficient research to recommend it as a replacement for brushing and flossing. Oil pulling works as an addition to regular dental hygiene, not a replacement. Here's the method Barbara O'Neill teaches, based on traditional practice and supported by research. Use 1 tablespoon of virgin coconut oil. Studies tested virgin coconut oil for its higher lauric acid content. Do this on an empty stomach, preferably first thing in the morning. Put the oil in your mouth and begin swishing. Don't try to swish vigorously for 20 minutes straight. Barbara suggests gentle swishing with rest periods. Swish for 10 seconds, rest for 10 seconds, repeat. Start with 5 minutes and work up to 10 to 15 minutes. The oil will mix with your saliva and become thinner. This is normal. The oil pulls bacteria and debris from your teeth, gums, and spaces between teeth. After the time is up, spit the oil into a trash can, never down the sink. Coconut oil solidifies at room temperature and will clog pipes. Then rinse thoroughly with warm water. Some people rinse with water containing baking soda after oil pulling. This neutralizes remaining acid. Wait about 30 minutes before eating. Clinical trials that showed positive results had participants do this daily for at least 2 weeks. Consistency matters more than duration. 5 minutes daily beats 20 minutes weekly. Important: oil pulling should never replace brushing and flossing. Research shows it works best when combined with regular dental hygiene. If you have active cavities or gum disease, see a dentist. Your daily diet has enormous impact on dental health. Research identifies specific foods that actively protect your teeth. Apples are often called nature's toothbrush. Barbara O'Neill recommends them as one of the best things to eat for dental health. The American Dental Association confirms that eating apples can lower your risk of gum disease and cavities. When you bite into an apple, its fibrous texture scrubs away plaque and food particles. The chewing stimulates saliva production, which neutralizes acids and washes away bacteria. Carrots offer similar benefits. They're rich in vitamin A, essential for strong tooth enamel. Studies demonstrate that crunching raw carrots massages gums and helps clean teeth. The high keratin content helps attack plaque. Celery is another crunchy vegetable Barbara highlights. Its fibrous texture physically scrubs teeth while you chew. Research confirms that celery's high vitamin C content supports collagen production, vital for healthy gum tissue. The common factor: crunch. Barbara points out that modern diets lack crunchy foods. We eat soft bread, pasta, mashed potatoes. This matters because strong jawbones are essential for dental health. Barbara explains that crunching strengthens teeth, gums, and jaws, similar to how breastfeeding develops strong jaw muscles in babies. Sugar tops the list of what damages teeth. Barbara O'Neill explains that sugar itself doesn't directly damage teeth. The problem is what happens next. Bacteria in your mouth feed on sugar. As they metabolize sugar, they produce acid. This acid damages your enamel. Research shows sugary drinks cause the most damage. When you drink soda, you expose your teeth to both sugar and acid. Most sodas have pH levels around 2.5 to 3.5. Your mouth's normal pH is 6.5 to 7.5. This creates a double attack. First, the drink's own acid weakens enamel. Second, the sugar feeds bacteria that produce more acid. This acid bath lasts 30 minutes or more after each sip. The way you consume these drinks matters enormously. Sipping a soda over 2 hours is far worse than drinking it quickly. Each sip resets the acid attack, giving your saliva no chance to neutralize. Studies confirm that people who sipped sugary drinks throughout the day had significantly more cavities than those who drank the same amount quickly at mealtimes. Water is your best friend for dental health. Research confirms that drinking water after meals helps wash away food particles and dilute acids. The safest choice for teeth is plain water. Flossing is one of the most critical dental habits. As one dentist said, "Only floss the teeth you want to keep," a quote Barbara O'Neill often shares. Research supports this. Flossing before brushing is more effective than the reverse.
Studies found that participants who flossed first, then brushed, had significantly less plaque remaining. Flossing loosens bacteria and food particles stuck between teeth. Brushing afterwards sweeps away what flossing dislodged. Here's why this matters. Your toothbrush can't reach between your teeth. These spaces make up nearly 40% of your tooth surfaces. If you only brush, you're leaving almost half your teeth uncleaned. Food trapped between teeth create a perfect environment for bacteria. In that moist, dark space, bacteria multiply and produce acid. This acid attacks teeth from the sides, where enamel is often thinner. This is where many cavities start. The National Institute of Dental and Craniofacial Research confirms that flossing prevents gingivitis, the early stage of gum disease. Left untreated, gingivitis can progress to periodontitis, where gums pull away from teeth. Research also shows connection between gum disease and overall health. Studies link periodontal disease to increased risk of heart disease, diabetes, and stroke. Floss at least once per day, preferably before bed.
Here's how to bring all this together into a practical daily routine. Morning. Barbara O'Neill recommends starting with oil pulling using virgin coconut oil for 10 to 15 minutes. Spit it out, rinse with water, wait 30 minutes. After breakfast, rinse your mouth with water and floss to remove food particles. Then brush with fluoride toothpaste. Throughout the day, drink water, especially after eating. Limit sugary drinks. Include crunchy vegetables like carrots and celery in your lunch. An apple makes an excellent afternoon snack. Evening. This is the most critical time. After dinner, rinse thoroughly with water. Barbara emphasizes the importance of rinsing after every meal to remove food particles before they rot between teeth. Then floss carefully between every tooth. Follow with brushing using fluoride toothpaste. Consider adding tongue scraping to your routine. Research confirms this removes bacteria that can recolonize teeth overnight. Stay hydrated throughout the day. Dehydration reduces saliva production. Your saliva is your teeth's natural defense system. Finally, see your dentist regularly. Professional cleanings remove hardened tartar that brushing and flossing can't. Early detection makes treatment easier and less expensive. Home care is essential, but doesn't replace professional dental care. This combination gives your teeth the best chance at staying healthy. Your teeth have remarkable ability to resist and repair early damage when given proper support. The research confirms what Barbara O'Neill teaches. Early-stage demineralization can reverse through proper care. Oil pulling with coconut oil, as recommended by Barbara, shows promise as an additional tool based on recent studies. The foundation remains. Floss daily, brush with fluoride toothpaste, eat crunchy fruits and vegetables, avoid frequent sugar exposure, stay hydrated, and see your dentist regularly. These aren't exciting secrets, but they're backed by both traditional wisdom and solid research. If this video helped you understand natural dental health better, show support by liking and subscribing. Share this with someone who needs this information. Drop a comment telling us which tip you'll implement first. Your teeth can last your lifetime with proper care.